Everyone, and welcome to our Hope Public Forum. We're going to give it another 2 minutes for a few more people to trickle in, and then we will get started. So stand by, please.
Recording the meeting while we wait a minute for other people to trickle in.
This conference will now be recorded.
And just a reminder to please keep yourself muted until you're ready to speak. We'll start in just a minute.
Camera. Hello everyone, and welcome to our public forum this evening. My name is Alyssa Rash. I am the Public Information Officer for Benton County, and I am here with you today to assist in discussing about the draft policy recommendations for the Hope Advisory Board. This meeting today is going to be facilitated by Julie Arena, the Hope Advisory Board's coordinator. And I'm going to hand it off to you, Julie.
Thank you so much, Alyssa. Alyssa is our wonderful public information officer with the county. And I've brought up just some go-to-meeting housekeeping here. You should be muted when you first attend, so please stay muted until you want to speak. You can also share your camera by clicking on the camera logo, and that will show your video to everybody who's attending. For commenting and questions today, if you can type into the chat, so you click on the little chat bubble and you type in your name and the general topic of what you would like to comment on. And for those on the phone, we'll also take some pauses so that there is a time for commentary and to give public feedback if you're calling in on the phone. Just to remind everyone, this is also being streamed via Facebook Live, so there's going to be some comments and questions coming in from Facebook, and those are all going to be recorded and documented and will become part of the meeting notes. So before we get started here today, I just want to remind the board members and anyone who's here attending from the public that the board wants to set a certain tone with the culture of communications that happen with the Hope Advisory Board for inclusivity and kindness and respect and curiosity and open-mindedness. So if we stray off course from those values and that culture, I will intervene and remind us how we want to interact with each other. Again, for those who are just joining, type into the chat, and we'll ask that you limit your comment to about 3 minutes or so to give time for other people. We'll see how many people want to chat and comment, and if there's a limited number of people wanting to comment, then we can go ahead and stay on that topic for a while for some discussion. Also, if you would like to submit some written commentary, my email is here, and I will also put it in the chat for attendees. So I wanted to remind the board members and anyone attending from the community that there are a couple different ways to give public feedback about the draft recommendations that the Hope Board has come up with. At this public forum is one way. There's an online survey, and there's a link to the Hope Community Engagement webpage there, and that link will also be available on the Facebook live stream so that you can click on it. The survey is open until Thursday, so I really urge you to go in there and take that survey today or tomorrow. In addition, I'm helping to facilitate some in-person focus groups for clients, individuals who are experiencing homelessness or people who are in need of services and support. And so far, we've had focus groups at Corvallis Housing First, at Community Outreach, COI, and tomorrow we will host one at the Corvallis Daytime Drop-In Center. And thanks to our partners with Unity Shelter and Safe Camp, those providers have already hosted a feedback session with individuals at Safe Camp. Again, here is my email, and feel free to email me with your commentary. So I'm going to go ahead and pass it over to our two co-chairs, Reese Stotzenberg and Jim Moorfield, to just read through an overview of the policy recommendations. So Reese, go ahead and take it away.
Thank you, Julie. So I'm going to cover the first 6 policy recommendations. Number 1, facilitate and coordinate data improvement efforts with community partners. Number 2, work with providers to create metrics to measure program success. Number 3, adopt a hub model of care coordination as a framework for doing business that coordinates existing partners to provide the best possible service to individuals. Number 4, full-time paid case managers are needed to support people transitioning out of homelessness. More case managers are needed who have commensurate experience and background that reflects the people they are serving from a cultural perspective and based on lived experience. Number 5, pursue the feasibility and implementation of a crisis response team. And number 6, Benton County needs a 24/7, 365 days a year emergency sheltering system for all populations with on-site resources at any shelter location to transition people out of homelessness. And I'll pass it on to Jim for the last 8 recommendations.
So number 7 on our list is to facilitate and support the creation of a resource center. By resource center, we mean a place where multiple service providers can meet with people experiencing homelessness. The problem of homelessness is complex, the solutions are varied, and we need to support in the most tangible way possible a resource center for those services to coordinate. Number 8, establish referral pathways to transitional and permanent housing resources for serious criminal offenders. It's no secret that people with who are sex offenders, people with felony convictions, often have trouble finding housing, and it's not to their benefit, it's not to the community's benefit that people with those backgrounds remain homeless. So we have to find solutions to that. Number 9, routine communication, notice, and community involvement need to happen on the topic of homelessness. We heard many times that the public doesn't know what's going on, and they'd like to know more about what's going on and what the service system is doing and what they can see with their own eyes sometimes, but don't know what solutions are being worked on. And an important part of that is that when services are going to be located in a neighborhood, it's absolutely essential that if those services are receiving public funds, that there be two-way communication with the neighborhood. Number 10, increase development or acquisition of affordable housing for permanent supportive housing. Permanent supportive housing is just what it sounds like. It's housing that is permanent, and it has the supports to help people with disabilities who are chronically homeless actually end homelessness in their lives. It requires housing units, the services themselves, and a way to pay the rent. Number 11, increase available rental and income assistance options. As I mentioned, whether it's permanent supportive housing or any form of permanent housing that helps people end the experience of homelessness, there has to be a way to pay the rent. And there's a variety of programs out there, the most prominent among them being the Section 8 program run by housing authorities. And it's important that the housing authority, the Lynn Benton Housing Authority, be a partner in solving the problem of homelessness and use their voucher capacity to help us solve the problem. Number 12, increase supportive services and stable funding to provide services to residents. And there's a list of resources, some of which are access that could be access to a greater degree, as well as potential sources that could be established to help us solve this problem. But it's clearly going to require some public investment. Then we had 3 recommendations that really are overarching recommendations that touch on all of the 12 recommendations I've already mentioned. But one is that to do more will require increasing the capacity of organizations that already exist, to find organizations that are willing to help us, and to invest in the capacity for local government, the city and the county, to do their part to address this problem. As I mentioned previously, it requires a public investment, but this is also an organizational capacity question. Building the capacity in our community to do more and to do it better. Along with that are funding recommendations that are overarching, that address different components of the service system. And on that list is exploring the possibility for a university community that doesn't collect property taxes from a significant portion of our community to help see to it that they become a partner in solving this problem financially. And then finally, legislative advocacy. We're not alone in this. This is a problem all around the country. It's a problem in Oregon. And we need to work on regional, state, and federal levels to create and support those systems that help us solve this problem. So we should always be working on legislative advocacy that helps our community progress.
Thank you, Jim and Reese. I think that is the end there, so I will stop screen sharing. And again, in the chat is a link to the Hope Community Engagement website where you can see the full policy recommendations. I'm going to see if we have any questions at this point. Alyssa, are you seeing any?
Yes, Julie, we do have 2 questions so far. The first one is for recommendation number 2, who are the providers you will work with and what would the metrics look like?
Do we have a board member who would like to respond to that question?
I could take a stab at it if no one else does. Xana Woodrow speaking. We have many community organizations that we'll be working with. There are several in the space. If I list them, I will inevitably leave out some. But I can tell you that the primary organizations that we are working with are Corvallis Housing First, Community Outreach Inc., CARDVA, 12-hour daytime drop-in center, community shelter. I hope we will be partnering more with groups in Albany so that we can synchronize our efforts across the river in terms of how we help unhoused folks among us. We also partner with and hope to deepen the partnerships with IHNCCO, the Medicaid organization, insurance company associated with Samaritan Health Services, with the tribes, with NAACP. So there are many, many groups, and we can't fully encompass all of them in our list right now, but that's a great suggestion to put that into the document that we put forth to the City Council and the Board of Commissioners. Again, at the risk of leaving someone out that we don't know about yet. In terms of metrics, we aren't there yet, and I would anticipate that that's going to be a major project for this group after we complete this plan, and we, the city and the county select priority items to work on and to invest in the near term, and then we will work on those metrics. But I can say that the most important metric is the number of people housed and stably housed after at least a year from the point when we find them a transitional and then permanent housing. But that personal outcome is all important. The other that's listed, we can look at our bylaws for this group and the criteria that we used to put together the plan. Equity will definitely be another one. In terms of racial and socioeconomic equity, disability, and we will also look at safety. And when we speak to safety, it's community safety, it is individual safety of the folks that are unhoused and of the rest of the community as well. So that's just a starting point. But our bylaws and the criteria for our work do point us in the direction of at least the buckets that those metrics for success will fit into.
Thank you, Commissioner Ojero. We have another question that has come in. I'll go ahead and read it and see if some of the board members who worked on this topic would like to respond. Benton County needs a 24/7, 365 emergency sheltering system. Who is responsible for creating and maintaining this system? Easy question, guys. Who wants to start to answer that based on the research and the data you have collected and your approach to this one? Well, I can say from my perspective, as a coordinator for the city and the county, that it is not one entity, and that is what the Hope Board is recommending, that there needs to be organizational capacity to facilitate, to lead, to bring together the different community partners and convene them and help them through the process of building out a full system of emergency sheltering. As it stands now, we have Unity Shelter that oversees the men's shelter and the women's shelter and Safe Camp. But we also have other entities that do emergency sheltering like COI and CARDVA and Chance. And so it is a collaborative effort that will have to happen for a system of emergency sheltering based on the research that you all have done as a board. But what is really being recommended to the city and the county in your recommendations is that capacity to provide coordination and leadership and facilitate all the community partners who will be necessary to support a full system of emergency sheltering. Jan, I see you unmuted yourself. Do you want to add to that response?
Yes, I know that this is a controversial, in some areas, a controversial concern because, but it's. I think what we have here is people may think that a congregate 24/7, 365 shelter won't have any conditions or any guidance or any basic transitional or community, shall we say, processes. I think people can envision, well, here's a shelter and it's a static warehouse kind of congregate situation, or you can look at it as a dynamic and productive and a pathway and a pipeline to housing. So I was going to say that it's, when we get to the point where we have the capability of having a shelter, it's not, I don't think we've got it set in concrete how this is going to be actually looking.
Jim, it looks like you want to add something to that response?
Yes, I think this kind of question will probably come up or could come up with a lot of our recommendations about what implementation looks like. And I think it's important to frame what we're presenting today, what stage we're at. And the stage we're at now is recommending overarching policies that define a direction that the city and the county, that we recommend that the city and the county go in the next few months and years. Implementing these policies is another step. We are not at a stage today where we're offering details on how to implement these things because the city and the county haven't adopted these policies yet. If they do, then the work of doing all the things that Jan just described on how to make this work and have it work well and responsibly, that will be the next step.
Thanks, Jim. I also think that in your recommendations you do mention that emergency sheltering is time limited and that progress will need to be made with a case manager, but that's a very individual determination based on a person being on a wait list for a voucher, or a person being on a wait list for rehab, or a person waiting to accrue first and last month's rent so that they can move into a more permanent situation. And so you have articulated some of that in your recommendation on the emergency sheltering system. I'd like to move on to another question that we have that came in on Facebook Live. What does a resource center look like? How do people qualify for services? And I know Peggy McGuire can't be here this evening. She'd be the perfect person to answer that question. Do any of our other board members want to describe the concept of a one-stop shop resource center?
This is Anita Earl. I would just offer that we were picturing sort of a cyberspace where we communicate, as well as a brick and mortar, where all the community organizations have a player at the table. And so when we receive word that someone is in need of help, be that through the police or the hospital system or any outreach effort, we are able to sort of wrap around that individual and determine who can provide the best need and who can meet any variety of needs, as social determinant of health needs are usually multifold, and it kind of requires a village to meet people's needs. So we were envisioning an ability to have communication amongst as many players as possible so that an individual would not have to retell their story over and over again, but that we would have some confidentiality agreements in place so that we could talk freely one time and be able to work as a team in the community to help someone. Beyond that sort of a mission statement, I don't think, as Jim said, we're not in the detailed section of that proposal yet.
Thank you, Anita. One thing I would add is that Peggy McGuire, the director of CSC, is continuing this conversation with her other community partners like the Council of Governments, or the COG, and Lynn Benton Food Share, and is meeting to talk about the logistics of this. If CSC and the COG and an entity like the Department of Human Services had office space and shared a large footprint of a building, what would that look like? And how would we be sure to include Benton County Health Department and office space for other providers like COI or Jackson Street Youth or Cardova or Casa Latinos Unidos, and make sure to engage providers as that unfolds. But that is part of your recommendation of that organizational capacity to help facilitate and coordinate and convene these partners on these different topics to make sure the partners who would occupy the building are part of that implementation. Jim.
Also, the question was how would people qualify? I think the thing to really clarify is that a resource center is where a number of different service providers can provide services in an efficient way and that is effective from the point of view of the person experiencing homelessness. The fact that there's a resource center with a number of different providers doesn't supersede their own, each organization's determination of eligibility. We're talking about independent organizations working together. We're not talking about some overarching set of eligibility requirements. Each organization, each service element will have its own eligibility requirements, and people will qualify or not qualify depending on what the service is.
Thank you, Jim. Are there any other board members who wanted to chime in on that before I move on to another question? All right, we have had another question come in from Facebook Live. How was input from the business community taken into account when developing the plan? And I have some insight to offer into that with the community engagement that I did in November and December, but then I'll hand it over to any of the board members. The business community was engaged via email and with myself and other board members of the Hope Advisory Board attending different meetings. So the Corvallis Chamber of Commerce and the Downtown Corvallis Association, myself and other Hope members who were able to attended those meetings and communicated with the leaders of those organizations to be able to present the overarching Hope topics, to share with those entities and the business community how to be involved, how to give feedback via survey, and I also documented the feedback that they gave verbally and shared it with the board. In addition to that, we have a business community representative on the Hope Advisory Board, Christina Jansilla. She owns her own business downtown, and she also communicates with the business community in her role. Did I miss anything, Hope board members? Overall,
I would add,
go ahead, Zan.
I would add, Julie, that I am the county liaison to the Corvallis Chamber of Commerce, and I do hear from chamber members regularly. I do know that one of the challenges that we've had is that there are problems now, and the Hope Board's work has not been to focus on the immediate, but has been to put together a plan of to do the heavy lifting of putting into place new resources to address homelessness, new facilities, programs, and so it's been there's been a tension there. So our work has begun, and indeed the relationships that have been built in the process of the Hope Advisory Board work have resulted already in new funding and a new facility in terms of the acquisition of the Budget Inn by Corvallis Housing First and in cooperation with Unity Shelter to serve as a shelter and then permanent supportive housing. So I acknowledge that we have not gotten to everything that the downtown business community would really like, and that we're increasingly hearing from the business community in other parts of town too, particularly on 9th Street. So we have work to do.
Thank you, Commissioner Ojero. Jan, did you want to add something to that?
Yeah, I just wanted to say that the business community the downtown community has expressed their concern about the center of gravity of the homelessness being in their district, and geographic equity is one of the solutions that we are looking at.
All right, we have a couple of questions coming in the go-to meeting. So the first one is, in point 12, how are residents differentiated from the homeless? And that came from Francis Shayla, I believe. Francis, do you want to clarify your question at all or add anything to it?
When I go through the draft, many terms are used interchangeably or without definition, like homeless, residents. So are these residents of Corvallis that are homeless, or is it due to influx from other counties or cities? Just what is meant by resident? So some of these terms aren't defined very well.
Thank you for that feedback, Francis. I think that I can work with the board to help include some definitions in their final draft of these recommendations. Is there anything else any of the Hope Board members would like to respond to Francis's question? Jim?
I totally understand the concern that not everyone who's experiencing homelessness in our community is from here. I would also say, though, that the nature of not having a home means your home is wherever you are, and I certainly consider people experiencing homelessness who are in our community as residents of our community. I don't want to play with semantics here because I understand that other people would see that differently, but I'm a pragmatic sort. So from a pragmatic point of view, I think if someone is here and doesn't have a home anywhere else, then they're a resident of our community.
Thank you, Jim. Jan, I see you're unmuted. Is there anything you wanted to say before I move on?
So with our coordinated entry, we will be able to define the new people versus the folks that have been here a while.
All right, thank you. This actually leads into one of the next questions. Have there been models or studies on how the proposed policies and resources may attract homeless from outside the area to relocate here? What is the mechanism for controlling this possibility? And I think one thing that I'll just offer up as far as the overarching recommendations that you all are making as a board is that legislative advocacy piece, that the Association of Counties and the League of Cities and our elected officials here need to advocate for some statewide requirements for emergency sheltering all over the state and accompany those requirements with state level funding to provide those beds so that you don't have this issue of Benton County and the city of Corvallis building a system and having people from other areas come to get services here because there's nothing where they might live. Do any of the board members want to add to that?
I will.
Go for it, Jim.
Okay. This question has been asked in 1,000 different ways since forever. It's a question that I've explored some in previous years prior to the pandemic. Embedded in the question is an assumption, and that assumption is that if we have a robust system of supportive services here that will attract folks. The embedded in that assumption is that other communities do not have similar supportive services. That's why, therefore, everybody will come here. And actually, that's an incorrect assumption. Many communities in Western Oregon have shelters. Many communities have 20 shelters 365 days a year. They have other supportive services I won't go down the list, but many communities have the kinds of services we're talking about. And so there's nothing, if we do something to strengthen our service system, it doesn't make us more special than a lot of other places. Having said that, I would also say that I've looked at data from a few years ago, and the per capita rate of homelessness in Benton County was among the lowest in Western Oregon, and I can provide that data if needed. And it kind of belies the assumption that we are attracting homeless people. Having said that, I think everything changed during the pandemic because it's a unique set of circumstances. I think a lot of communities did not do what Corvallis did, which is kind of hold in abeyance its enforcement of camping that's illegal. So I think we have experienced something that's different, and but I think that's going to end. And I have no reason to believe that strengthening our service system is going to attract more people than it has in the past, because we're not alone in this. Lots of other communities are doing the same thing and are actually ahead of us in many ways.
It looks like Andrea also wanted to respond to this. Andrea, you put something in the chat, but I know for the callers, they can't see that. Would you go ahead and read what you put in the chat?
Sure. I just wanted to say that it's important for everyone to understand that homelessness is a problem throughout the state. There's also no one program or policy in our state or in our nation, for that matter, that guarantees people experiencing homelessness have a safe place to sleep or live. It's basically you're cobbling together resources from a number of different places to try to create a social safety net. It's basically up to each community to provide these solutions, and the problem that we have is that we have not made adequate investments in affordable housing and lack programs and support for people with significant mental illness, disabilities, and other issues. Housing in Corvallis has grown increasingly unaffordable to low and very low-income residents, and you can't have low rental availability, high levels of inequity, and unaffordable housing and not expect consequences.
Go ahead, Alyssa.
Julie?
Hold on.
Julie?
Hold on just a second, Carol. I just want to remind folks that they can also ask questions on the Facebook Live. And we do have some coming in that way, but just as a reminder to folks. Go ahead, Carol.
I just wanted to re-echo what Andrea and Jim are saying, that when we did our first housing study on homelessness in Corvallis about 4 years ago, we asked the question for various people, where are you from? And 3/4 are from this area. So I don't think, and as Jim said, we've got people from Corvallis who are in Albany and Portland and going to other places. So if it's kind of a wash. When I did some work in Albany, a lot of the people who were at the shelter there were Corvallis people. So I think when you start parsing out, are you from Corvallis or someplace else, that's just that's not going to get you anywhere. And I think the data shows that also.
Thanks, Carol. Jan, I think you've been waiting to chime in.
Yeah, I just wanted to say that I spoke with two folks down at the Pioneer Railroad Trestle on Easter. Two of them had been there for 4 years. I suppose that speaks volumes. But I do want to point out that when the pandemic hit, we used to have a lot of folks living across the bridge in Orleans. There's nobody there now. They've moved into the Greenway inside the city. So you see that there is this mobility, and homeless populations have been historically very mobile, and that's how they compensate. And this has gone on for eons. So I think that if you look at any population or any homeless population, you're going to have a certain percentage that are new and they've come here. The services being offered is certainly some incentive. Obviously, we don't have too many people homeless in Monroe. I'm just saying it's kind of a mix, and we don't really have a handle on this yet. quantitative handle on this, not a very, very sharp quantitative handle. And so we're still going to be working on this.
Thank you, Jan. Reese, I saw you wave your hand earlier. Did you want to chime in on this topic?
I was just going to make a quick, in response to the mechanism, his question about a mechanism to not attract people here. And I know I was just going to point out, and I know legal rulings are always controversial, but the Ninth Circuit Court ruling, which if we comply with that ruling, which states if you provide somewhere for them to be, then you can make the camping illegal, that the mechanism would be compliance with the Ninth Circuit Court ruling. If everyone who is experiencing homelessness, we have somewhere for them to be 365 days a year, then you have the ability to have legal mechanisms where, you can cite the 10 campers and say that they need to go to the legal area. So as a technical mechanism, the compliance with the Ninth Circuit Court ruling seems like it would go a long way.
Thank you, Reese. I'm going to move on to another question that came in on GoToMeeting. To track homeless people's needs and their re-encounters, could they be tracked by their name and some kind of governmental ID, like a social security number? Whenever there are interactions with governmental agencies or support groups, they request information like that for benefits. And I wish Peggy was here so she could talk about all of the tracking that CSC does with their programs. Does another board member want to respond to that? Zan?
I can take a quick stab, but I think Jim might be better equipped. There's a certain amount of tracking that's mandated by the Federal Housing and Urban Development Agency, also known as HUD, and the Community Services Consortium, and Peggy McGuire represents them on the board, is the lead agency here locally that is responsible for a lot of that tracking, because they receive a lot of those federal dollars and then we grant them to all of our service agencies. So there is kind of a floor of data that is collected. And then beyond that, we have some fantastic local folks here, like Brad Smith with Corvallis Housing First, that have developed more user-friendly software to allow us to track the folks that are being sheltered. And that software has been adopted by several local groups and allows us to do a lot better tracking across agencies now, so that we can grade those services, wrap services around people, and try to avoid duplication, but provide the best support possible.
Jim, did you want to add to that?
Just one thing. I mean, this question relates back to what I think it was recommendation number 2, if I remember my numbers correctly. But it was the one about data and metrics. I mean, that's part of what we're saying there, is that we need to have a way to measure what we're doing, to track people, to know who's who, and so that we can serve them more effectively, and very importantly also figure out whether the work we're doing is working or not. And it does require a robust system like that. The data system that CSC uses, but also as a requirement on some of their sub-grantees, is the Homeless Management Information System, HMIS. And not everybody uses that or is required to, and now and I don't know who is and who isn't. I don't have the answer to that question. So.
Thank you both. I'd like to take a minute to answer a couple of questions that have come in. The first one is, how did the Hope Board develop these draft recommendations? And if there's a board member who would like to explain the process you've taken over the past year, please chime in. Otherwise, I can help provide an overview. Okay, I'll go ahead. The board, based on the mandate from their bylaws, looked at all the available data did research about what a successful system of housing and supportive services looks like, and also did a gap analysis of all the gaps here in Corvallis and all over Benton County. And they looked at that data and the research in the gaps, and they prioritized by the values in their bylaws. The first one is community safety for all. The second one is prioritizing by vulnerable populations, for instance, children, elderly, vets, our LGBTQ community, and then also prioritizing by racial and ethnic justice. And so that happened last summer, looking at those different data sets. And in the fall, in October, the board prioritized 4 main topic areas about the need for helping people who are currently experiencing homelessness, people who are in crisis due to lack of housing, and the need for emergency sheltering, transitional options, and permanent supported housing. And then the board engaged in 2 months of community feedback in November and December, feedback from clients experiencing homelessness, feedback from a wide variety of community members, and online survey feedback. And they took all of that public feedback and combined it with the research and the data that they had collected, and in January and February put together these draft recommendations. And then based on feedback from different community members, in March the board decided to share the draft of these recommendations with the public, now that we've gone from concept and topic area to actual draft recommendations. So that is the process that this board engaged in. Did I miss anything, board members? All right. I'm going to move on to another question about your process as a board. I understand the HOPE board consists of City of Corvallis and Benton County members. How does the board interact with other cities in Benton County? I can answer part of that, but Commissioner Ojero, can I look to you as far as the greater county interaction? Would you like to answer part of that?
Sure. I would say that we have specific representation on the HOPE board from Philomath at this point. When first appointed, Catherine Biscoe was not a city councilor, but she is now. And the city of Philomath is definitely engaged when it comes to these questions. They also have a service, at least one service provider, providing a lot of housing for folks that otherwise would be unhoused, and that's Harriet Hughes and the Hughes houses. We also have been conversing regularly. When I say we in this case, it's both Julie Arena as a staff person and then the Board of Commissioners and our county administrator with the cities of Badare Village and Monroe. We have regular quarterly meetings with the city managers of those towns, and so we keep them up to date about the HOPE planning and always inquire as to their needs and their perceptions of what homelessness looks like. Julie has actually made presentations to the city councils of both of those cities as we've moved through this process. There are also a lot of unincorporated communities, LC, the Wren, Blodgett area, Summit, Kings Valley, and we have a HOPE board member from Kings Valley, not from the other areas, but we are very cognizant of the needs of those areas as well. And that's the reason for the recommendation that we've made, that we need to have mobile capacity as well as some sort of a resource center where folks can go out and perhaps one day a month offers the services of some of these different agencies to folks that are unhoused in these smaller communities. And lastly, homelessness looks different in rural areas. We know that. People tend to double up. They are living in trailers, campers, cars, or a shed out on the back of the property. So they are not living rough in the same sense as some of the folks that are living here in urban environment, and sometimes they're harder to observe and find. But we need to have the array of programs that provide support for those people to transition into safe and healthy living conditions as well.
Thank you, Zan. And I'll just add that as a staff member for the HOPE Board, I've done targeted outreach with the city managers of all the other incorporated areas in Benton County and to the city councils and mayors. And as far as the unincorporated areas like Alsea and Kings Valley and down around Monroe, I've also done outreach to the service providers. So the people who are serving individuals in need or doubled up or sleeping in their cars or RVs to make sure that the local governments and also service providers are included in this feedback effort. All right, I'm going to move on to a question. What are the limitations of the project with respect to an overabundance of the number of homeless considering limited resources? How do you select what services to limit? Easy question, guys. Come on. That was a very difficult question. Do any of our board members want to take a stab at that?
Could you repeat, please?
Absolutely. What are the limitations of the project or the recommendations with respect to an overabundance of the number of homeless considering limited resources? How do you select what services to limit? I think this is getting to the concept of we can't serve everyone with limited public resources. And I think it speaks to how you as a board have prioritized by vulnerable populations, community safety for everyone, and racial and ethnic justice to really start on the emergency end of the housing spectrum with a need for emergency sheltering and a need for crisis response and transitional options and permanent supported housing for our most chronically homeless and our individuals most in need. But Jan, do you want to add to that?
I would like to point out an observation that I have, that Corvallis is a very, very, very generous community. We have food, clothing, we offer, this is from private individuals and religious organizations, shelter tents, so on and so forth. You know, in our daytime drop-in center, we've got services there for charging. But so what I think we really, really need, it's not that I would rather spend our efforts and our money in getting transitional housing in place, getting housing built, ADUs, micro shelters, permanent supportive housing. We've messed around with I guess you call it harm reduction for 15, 20 years now. What we need is housing. So I think that when we look at how we're going to prioritize or what services we prioritize, what services we don't prioritize, yes, everybody needs to have sign up with OHP. Everybody needs to have, hopefully, a Social Security number. Everybody needs to have access to the benefits that everybody else has. But then you really do need housing for any of this to work. And I think that, allowing people to live in the parks or on the streets, yeah, they have food, yeah, they have water, yeah, they have emergency care. But what they really, really need is not what we actually have at this point in time and that we need to work toward.
Jim, before I go to you, Christina is noting that she would like to respond to this one. Christina, go ahead. Are you able to unmute yourself, Christina? Okay, I'm going to go ahead and have Jim answer while you figure out your muting. Go ahead, Jim.
Just building on what Jan just said when she was talking about housing, I think the thing to understand is these recommendations are a starting point. They're not an ending point. We will continue to work on the policy, on future policy recommendations that help our community go to the next level. We're recognizing that we just can't do everything all at once. So we decided, based on the prioritization that you already summarized, Julie, that this is a good place to start with this list of 15 recommendations. But the future holds more work on what else is needed towards helping people who are experiencing homelessness not be homeless anymore. And I think critical to that will be how we address our supply of affordable housing.
Thank you, Jim. Christina's typing into the chat. That's why the data is very important. Christina, are you able to unmute yourself yet? I'll go ahead and read your response. With the metrics, the data metrics, we can determine what programs are valuable and what programs do not get utilized. Zan?
Julie, can I add to this?
Absolutely.
I would like to say that I agree with what the previous board members have said, and that in addition to that, one of the things that we most need is the case management, because we can provide tents and warm coats, but if we are not working with each individual to address the problems that led them to end up on the streets, we're not going to be able to either help them become employable or houseable again. And it takes time. It's an intense process in many cases of healing past trauma and substance use issues and addressing mental health issues, physical disabilities, chronic disease that have led to people becoming bankrupt and living on the street. So I would like to emphasize that this is going to take people, and that's always an expensive proposition and sometimes the most difficult thing to support year over year. But there's increasing recognition of this fact, and so we are seeing additional state and federal resources put towards case management.
Thank you, Zan. I'm going to try to unmute you, Christina. Test, can you hear us? Can we hear you? Go ahead and try.
Hello?
Yes, Christina, success. We can hear you. Go ahead.
Okay. All right, thank you. I'm sorry, I know this is a little late, but I think that's why the need, as we recommended, the data is very important. And with that data, we can determine what programs to fund and what programs that need to drop, and who's utilizing the programs and what isn't being utilized. So we should be really careful and mindful of the money and the resources, and we are data driven. That's why the data is very important, so that we can determine where we need to put a little bit more emphasis on what program and where we need to pull it from.
Thank you, Christina. Jim, I see you're unmuted. Did you want to add anything more before I move on to the next question? Okay. The next question. Considering the offering of benefits and services to individuals experiencing homelessness, are there any expectations of their responsibilities or accountabilities, like behavior or trash pickup? Several times I see campers leaving huge messes when they relocate. I know some of this is built into your recommendation in emergency sheltering. Would one of you like to respond? Jan, go for it.
Right. So as far as I know, you have to look at this again. I went down to Pioneer Park and I spoke with half a dozen folks, and they explained they would love to have a dumpster there. They would like to clean that place up. They want to help. They do. And one of the other things that I found out is that they do not appreciate appreciate the crime in the area. They don't appreciate there's a number of hoarders that have behavioral issues. This is where you see the spread out mess. A, they don't have dumpsters to put it in, and B, they have personal issues with keeping things and finding things and putting them in their possessions. So we need counseling, we need caseworkers, we need social workers, and this is the part and parcel of the issue is that when you get down on ground level, you really have to get these folks help in some way or fashion. And not everybody that lives down there is they're all different, and some are extremely lucid and extremely want to help with the community and want to be part of society.
And Jan, I'd also add, as far as your recommendations go for emergency sheltering, you have included a recommendation that there be opportunities for involvement, but a lot of the funding that goes for emergency sheltering has requirements that people not be required to do something to be able to be sheltered. Okay, I'm going to pass it over to Andrea as well, who wanted to answer this, and then Christina.
I also just want to, this kind of goes beyond the scope of maybe what we're talking about today, but I think that there's often an expectation of people that are experiencing homelessness to pay back for services or for the things that they're doing or to contribute. But what I would argue is that, when we see people living in tents in the community, it's basically like opening up your house or your neighbor's house to whoever is walking by. It's basically like opening up your home to other people in the community. Of course, there tends to be a lot of judgment that we pass on people, when we're basically invited into their living room or into their living space every day because it's right out there in the open. And there's some thinking that, people should pay back things, they should be doing this or that, or they should be behaving in a certain way. When I think other people have said this, and I would echo it, that or Jan started to say this, but there's significant people that are living on the street are in crisis. A lot of folks have significant mental health problems. They have drug addiction. There's other things happening. They have to carry all of their belongings with them all the time. I think that if any of us had to do that, we would have, things wouldn't necessarily be totally organized either. So I think that's something that we, as a Hope Board, are aiming to do to help educate the community about what homelessness is and what are some of the realities for people that are living on the street.
Thank you, Andrea. I know Christina wanted to chime in on this as well.
Can you hear me?
I can. Go ahead, Christina.
Okay. I too am a business owner, and I am affected by all the tent camping. And I would like to say that is so, this is why this board is so important, that we can systematically eliminate the tent camping and everything that goes along with the tent camping. As we know, it's the trash, vandalism, you name it, I can go on. And that's why this is so important, to have all these pieces in place so that we don't have to look at the trash that's left behind, that there is some place for the unhoused to go. So I understand the frustration, and it affects me deeply too, but that's why it's so important. Our recommendation is to eliminate that. We're trying to eliminate that.
Catherine and then Reese.
So I'd just like to share the perspective that there's an assumption that people choose this lifestyle, or that maybe this is where they want to be, or they just want to comply The reality is that I would say that the largest majority of our homeless individuals are not choosing this lifestyle. It's a circumstance where they've found themselves, they don't know how to get out. Having served at Tolomas Community Gleaners as a program manager for almost 2 years, I can assure you that there is a great value to valuing individuals, allowing them the opportunity to take responsibilities as they're able to, depending on their circumstances, to contribute to their community. And so they want difference in their lives. They want to contribute. They want to be part of a community, and they want better for their lives. A part that I think sometimes we're missing or we're overlooking is that it's very important that they find a nurturing environment and the right individuals and the right programs to allow that responsibility to happen, to allow that reincorporating back into the community. And I think that overall, if we can establish a program that has that sentiment and has that intent, and I believe that's happening with Hope. I certainly am hearing it in conversations. It might not be on these documents in specific letters, that if we create that environment, we're going to find that our homeless community members are going to step up into bettering themselves, contributing to the community, contributing to their own environment around them, and taking those responsibilities and what we call accountability, actually just to improve their lives and their circumstances. So those trusted individuals are going to be important. What we put together as a program is going to be equally as important to provide that environment where, yes, we're here to help. We want to make things better for you, and we want to welcome you into our community.
Thanks, Catherine. Reese, did you want to chime in before we go on to the next question?
Just really quickly, I know in the past I've used the term accountability measures when I was really trying to actually describe more of a training program that would help them morph into society or get to a place where they are bettering themselves. And I think sometimes people think holding them accountable is a way to teach them to rejoin into a positive direction. And so as important as the teaching is, I just felt like sometimes when people say accountability measures, I've in the past had the mistake of I should have worded it training programs or something like that, because holding somebody accountable is similar to teaching somebody and then finding out if they're accountable. So.
Thank you, Reese. And I'll just remind community members who have tuned in that this is also an opportunity to give feedback on the policy recommendations. And we appreciate all of these questions and the opportunity for conversation and to answer the questions. But if you have feedback on the recommendations, feel free to type that into the chat as well. I'm going to move on to the next question. Hope Board, could you consider how the military used temporary housing, such as separate or movable barracks for each group at shelter locations? Also, why not have mobile resource centers using RVs, perhaps, to visit the shelter locations? Do any of our board members want to tackle that?
I would just point out that micro-shelters, I think, was a creative way, similar to barracks or something, that we kind of found out provides a locking door and solves a lot of problems at a much reduced cost.
Thank you, Reese. Additionally, I know that part of one of your recommendations is the need for mobile resource delivery. So if you look through the full length of policy recommendations, this board has included the need for mobile resources to go out to rural Benton County areas and then scattered sites of micro shelters or emergency sheltering. Jan, is that what you were going to say? Go ahead.
Oh, I was just going to say you could maybe Flip Anderson would be able to add a little bit about small villages. Thank you.
Okay, you might have to turn me off so you can continue this talk. But the small villages that I'm imagining do include training programs and And I envision it in a place where, and I know that we have a need for real high density, and so I'm starting to include it where it's some apartments for like elderly people that would be close to resources. But I think transitioning people from camping into micro shelters is a really good way, and they are in. It's a very good way. It's a low cost resource, and I also want to mention, like was mentioned earlier about religious organizations. I think there's just a real strong desire for people in Corvallis to be able to donate and contribute, whether it's resources or building them, to build these shelters. And so my ideal is to have a place that's park-like so that people could do wage earning by, keeping the grounds up. There could be a restaurant on site where it's nonprofit, so people could have small shifts and earn money and learn how to return it back into the bigger community. Anyway, and also places for offices. So I'm thinking about 6 acres of land, and if we could just get land, then we could start doing this really fast, and we would make a big difference. Because, homelessness means housing's the solution. So today I was out with visiting homeless people, and they were asking me, I signed up for those 15 shelters, but I hear there's 80 people on the list, but I still want to sign up. And so I think there's a big felt need for these, and anyway, that's where I come from.
Thank you, Flip. And I'll just remind for people tuning in that the Hope Advisory Board, as an advisory board to the city and the county, is not going to be doing the implementing of these recommendations. And Flip, I know you are a service provider in your own right, so you will likely be involved in whatever ends up happening in the community. But just so that we manage the expectations of what this board will be doing, that's where the recommendation that you all are making about the need for organizational capacity to implement these is so important, because this is a 21-member volunteer advisory board to the city and the county that will not be doing the implementing of these recommendations. And Anita Earl, you typed in about the Samaritan van for mobile service delivery. Would you like to voice that?
Sure, I just wanted to offer my appreciation for the concept of having resources and traveling to where the resources are needed. That was such a great comment. And Samaritan does have a medical mobile van that reaches out into all local communities and shelters. It's had some mechanical difficulties recently, but has certainly responded to the drop-in center and the men's winter shelter. And we're going to continue those outreach efforts. And I would also offer to the community members that there are many local organizations, including Samaritan, that have social workers who go out into the communities and shelters and provide services and triage with the hopes of increasing access for behavioral and medical medicine.
Thank you, Anita. All right. Did any other board members want to chime in on that before I move on to another question? Okay. One of the questions is, how is affordable housing defined, and how will rent be controlled in Corvallis and Benton County? Before I pass it off to one of the board members to go ahead and touch upon this topic, affordable housing in general is not one of the priority topics that the board is tackling at this stage, based on the data that they reviewed of people who are currently experiencing homelessness and the need for emergency sheltering for them and crisis response for them, and permanent supported housing for individuals experiencing chronic homelessness. But I know that as a board, come May, you all will reconvene and decide what your next steps are, and the topic of affordable housing, prevention, messaging and education and advocacy and outreach are all things that this board is excited to tackle in the future. But is there someone who would like to comment on this specific question about how affordable housing is defined, and any touch upon rent control in Corvallis and Benton County? Jim, I'm looking at you.
Affordable housing is defined as housing that does not cost more than 30% of a low-income household's income for rent and utilities, or 30% of their low-income household income for principal, interest, taxes, and insurance when it comes to home ownership. So there is a specific definition, and it's one that is used at all levels of government for various programs related to affordable housing. Rent control, if by rent control the questioner means the kind of regulatory system that exists in, say, New York City, rent control is not possible in the state of Oregon. There are various laws having to do with how fast rents can increase in certain communities, and some limits on increases, but there's no such thing as rent control in Oregon. Instead, our strategy for increasing the supply of affordable housing is to create more housing where the rents are structured to be lower than market, and to build more and more of those. Those are regulated, but they have special subsidy attached, and that subsidy has strings attached to it, and that's what we do primarily to increase the supply of affordable housing. There are other strategies that we won't go into. That's really, as Julie said, in our future to consider what some of those might be.
Thank you, Jim. There are a couple more that are in this same vein of affordable housing, so I'll be sure to read them in case you would like to touch upon them now. One of the questions is, how does the board tackle the issue of needing more and more affordable housing versus the need to protect natural areas and the environment and promote wellness for its community members? Jan, is that your dog? Can you please mute yourself? That's all right, it happens. Do any of you want to touch upon this, or should we just note that you are not at the stage yet to tackle affordable housing in general? Go ahead, Jim.
I won't give a big speech on this one, because that's the kind of question that deserves a long answer. The only thing that I would say is that we have a land use system in Oregon, and goal 10 of that land use system, and it's a goal that every community has to face, which is how to address the housing needs of their community. There are other goals, including ones that have to do with environmental responsibility, environmental health, and so on. And so it's an ongoing balancing that every community has to address. There's no one answer to that question. It is a process, and it's one that I'm proud to live in a community, a city, and a county that takes that process and those responsibilities seriously.
Thank you, Jim. Jan, did you want to chime in on that?
Yeah, I just want to, people should, I think they realize that how expensive Corvallis land is, we spent the last 30, 40, 50 years making sure that it's very expensive, with our policies. But the community development of Corvallis, they are the ones that can help with this problem. The state can help with this problem. And we're just, it's a really big problem. And it's not just finding, it's not just, we're just going to build it. It's very complicated, very long term, and I have the utmost confidence, and I hope everybody will agree with me, that our community development department has this right in the forefront of their policies and plans.
And I'll also just touch upon that you as a board are including under your recommendations on increasing permanent supported housing, which needs more affordable housing units, that community development departments with the city and the county work together to proactively look at available land that is zoned correctly, and to help facilitate this process as well. This is another question that has to do with the affordable housing topic. How do we work to get more affordable housing in a community that has such a low vacancy rate? We've tried unsuccessfully for years to have this and haven't been able to. So what has changed that makes this possible now? And I'll just add one thing that I have noticed is the state and federal investment in housing and permanent supported housing and affordable housing is unprecedented. What's happening now at the federal level and in the Oregon State Legislature to fund affordable housing development, permanent supportive housing development, and the supportive services and crisis response that go along with it is really amazing. Zan, I see you nodding your head. Do you want to add anything more to that?
I would just concur that the resources that we see coming online right now are very significant, and I think our plan is going to be extremely timely to position us to be able to take advantage of some of those resources that are coming online. That gives me great hope. I also would say that building the relationships that we have in this body and the diversity of people around the table at the Hope Advisory Board have been instrumental as well. We have worked really hard to integrate all the voices and to answer community questions, and all of your comments and questions and suggestions have only strengthened the work that we've done. So I think that with that spirit, we have the potential to accomplish a lot.
Thank you, Zan.
Julie?
Yeah, go ahead, Carol.
Well, I think we might have the spirit to accomplish a lot with housing people who are homeless, but affordable housing we're nowhere near that. We're nowhere near with any help, any place on increasing the affordable housing. I think I just read a statistic from the city that how many houses we would have to build in a given year if the people who are commuting to Corvallis and want to live in Corvallis could live in Corvallis. And it's over 100, like 400. I don't want to say a figure because I don't really remember, but it was quite high. And there's no incentive for builders to build workforce housing or middle-income housing. And as long as we don't bring in more land, I mean, I don't see an answer to this one. I mean, I agree that there's a lot of effort at homelessness, but there's not. Even Senate Bill 2001 that says let's have more duplexes and triplexes doesn't guarantee that we're going to have more affordable housing. So I think we're in for a long haul here, and we're disenfranchising the very people that we need to bring in a lot of energy into our community.
Thank you, Carol. And I know that's why affordable housing will definitely be a topic that this board tackles as you move forward. I'm going to move on to another question that has come in about accountability. And I think this was a follow-up as far as accountability for people accessing services and being sheltered. How about until you all agree that they can be productive members in the community? Who passes this? Ultimately, wouldn't that be their payoff? This is about accountability for being able to access services and becoming productive members in the community. Do one of our board members want to touch on that topic? Catherine.
So I'm going to go back and tackle this one again. My family has lived in this situation after the recession in 2008. I can tell you there's nothing quite like being afraid of where you're living, whether or not the police are going to come or the Child Protective Services are going to come evaluate your situation and take your family. You wonder where you're going to get your next meal, where you're going to go to the bathroom, where you might wash your hands. Clean clothes are, an imagination, right? It's very difficult for most of us that are sheltered, that do have jobs, we have paychecks, we can go to the bank, we can go to the, Burger King, we can go to the grocery store, to really have a concept of what that looks like. And I think it would be inappropriate for us to assume that we want people coming out of these crises, and some of them for many, many years, to be immediately contributing members to our community in order for them to get help. I think help is something that all of us have experienced in our lives. I don't know how often it's come with strings attached. Definitely in this situation, our first and foremost responsibility should be to address the human needs of these individuals. It's not a safe place to be, and by no means is how you're going to contribute the first and foremost thought in your mind. With that, over time and over stabilizing individuals and their households or their families, certainly I again reiterate that I feel that most people's intent is to be contributing to their community and providing value and a sense of self-worth, and I think we just need to take that a step at a time and address the crisis first, and then provide that opportunity for contributions as they get stabilized and established in our community.
Reese, and then Jim, and then Anita.
Oh, I was just going to point out that the requirements put on the individuals to hold them accountable is left up to the service providers. And I don't think the Hope Board really, because each service provider is going to have their own requirements. And so I don't know that the Hope Board can say much about that or influence it too much. I do support training programs and things like that, though, that we should,
And before we go to Jim and Anita, I'll just remind our board members that this is really a forum for the public to give you all feedback on your recommendations. So go ahead and make your comments, Jim, and then Anita.
I just wanted to, I don't have the numbers in my head, but it's certainly information we've looked at in the past, but the percentage of the homeless population, especially the chronically homeless population, that have a disability, especially mental illness and substance use disorders, and both of them together. And that doesn't mean that folks with these challenges don't still have responsibilities, and including to be accountable for their own behavior in their own lives. They do. But it's also, we're talking about illnesses that get in their way and are in too many cases left untreated. And a significant subset of that population are veterans. And when I hear criticism of homeless people as somehow just being irresponsible, I am reminded of all the people that we've sent off to war who've come back broken and now are living on our streets. And these are, well, I could give a speech about that. The point is that I find it a shame that we just point fingers and say they're not doing everything they should to take care of their lives. I think what our job is to do is to create a system that provides opportunity. And I think if we do that, because we don't have that now, or we only have some of it, of what's needed, but if we can do a better job providing opportunity, I think we'll see more people making use of those opportunities and doing what they can to get their lives together.
Thanks, Jim. Anita, did you want to chime in before we move on? Anita, I'm guessing you're indisposed. If you want to chime in, let me know. I'll move on to the next question for you all. Are you going to help homeless individuals get retroactive systemic and social justice, since this is a major factor into the behaviors you are saying is mental illness? So I think this is some feedback about where any systemic or social justice is interwoven into your recommendations. All right, do any of our Hope Board members want to respond to that? That's a hard question to answer. Reese, do you want to go, and then I can chime in too?
I'm going to point out the 2 case manager hires, one specifically for the indigenous population and one for the Black population, might be a representation of a way we met we're trying to, direct the outreach towards the affected demographic.
Well, and at least from how you all prioritized with the bylaws to prioritize by racial and ethnic justice, you as a board looked at the data across the spectrum of individuals experiencing homelessness, individuals in transitional living or permanent living, people who are receiving vouchers or rental assistance from CSC, and the areas where we saw the most racial and ethnic disparities is in our unhoused population. Individuals who are Native American and Black are far more overrepresented, and so this board prioritized to focus on that end of the housing spectrum first, to try to get people off of the streets and into some kind of stabilizing emergency or transitional living situation. Zan, did you want to chime in more on that? Okay, I thought you were nodding your head.
No comment.
Okay, thank you. I'll move on to another question here. Give me just a second. The draft recommendations are a great place to start. I am concerned with project implementation. What are some thoughts around implementation? Ongoing collaborations and conversations are important. Janice, thank you for your question. I love working with you. And I think that's really speaking to the organizational capacity recommendation that this board is making to the city and the county, that there need to be staff to work on these solutions and to implement them, and to provide that leadership and facilitation and coordination and project management expertise to help our frontline service providers like Janice and others throughout the community to build their own organizational capacity to implement this system of services that you all are recommending. Does anyone else want to comment on Janice's question or comment?
Yeah.
Jan? Go ahead.
No, I think, we have been invited by the state legislature, the city government, as elected officials, to chime in on our CARES, C-A-R-E-S, funding that's coming in shortly, and this is exactly where we can make how we would like to see these go toward implementation of something of this nature of our plan.
Any other board members who wanted to chime in on this feedback? All right. The next question we have is, what is the timeline for implementing these recommendations? I think this is a good question, and I think it's something that you as a board are grappling with based on feedback from different members of the community, like Mayor Chaz Jones in Philomath, asking that you really look in your work groups in the next week at some sort of phased implementation recommendations of what could happen now, what needs to happen first or second, what will take quite some time to implement. And some of that implementation and the timing of it is built in throughout your recommendations. But I do think there's some work left to do next week when you meet in your work groups to flesh out what could be acted on more quickly than other parts of your recommendations. But do any of you as board members want to respond to that timeline question?
I can repeat what I've said before, that I think that we really need to be clear about what we can accomplish in a year. What's the low-hanging fruit? What we would consider as a 3-year goal or a 5-year goal, just so that we can set realistic expectations. There are clearly some items here, especially anything that requires land acquisition, it's going to take longer. So we need to be aware of that and not promise anything tomorrow. And I do see that Jan has put into the chat the fact that the state legislature is going to be holding hearings by congressional district around the state to talk about budget priorities, particularly in light of the American Rescue Plan dollars, not CARES Act dollars this time. But yes, there will be significant funds for one-time investments in our communities, particularly with reference to the effects of COVID, and the increase in homelessness is one of those effects. I do have to caution everyone, though, that we don't have guidance from the federal government, from the Treasury Department yet, about how those dollars can be spent. So we are dreaming big, deep and wide, and then we'll have to figure out what actually can be funded with those new resources. But hopefully housing and case management will be key to that.
Thank you, Zan. We have about 20 minutes left and a couple more questions that have come in on GoTo and Facebook Live. So I'm going to go ahead and move on to the next one. Has anyone pursued the Army Corps of Engineers for building support for low or no cost OSU engineers as a project work? Does anyone want to comment on that suggestion? Jan, go for it.
That would be fine. We just need land. That seems to be the issue.
I think that the Army Corps of Engineers, I don't think would be a good fit, but certainly there is a lot of volunteer effort that we could perhaps involve in any kind of project. The ROTC does free projects out in the community, and some of those folks might have appropriate skills, for instance.
All right, thank you. I'll move on to the next question. How do the efforts of the HOPE Board intersect with the county's criminal justice system improvements? Is this duplicating any work? I have some commentary on that just from helping you draft your recommendations. One in particular about the need for crisis response, like immediate deployment of mental health professionals or peer support specialists for people in crisis due to homelessness or behavioral health crisis. You as a HOPE Board are making the recommendation that that is needed, but noting that the Criminal Justice Systems Improvement Plan and also Benton County Behavioral Health and the Willamette Criminal Justice Council are pursuing this topic, and they're doing it in partnership with experts on crisis response. And so that is where you can see the intersection of the HOPE Board's research and data recommending a priority policy like crisis response, and noting that the effort is happening in another area of our community. Zan, do you want to go ahead and add anything to that?
I think you covered it pretty well, Julie. I would say that one of the challenges that we have sometimes is the ability of the data systems to talk to one another, to be able to use data from the hospital system and from mental health providers at the county and the homeless system to understand where there's overlap in terms of the individuals that are involved with the justice system. So that's something that we're working on, and that our behavioral health staff is actively engaged in with the Corvallis Police Department, and hopefully we'll be setting up some pilot programs starting this next fiscal year in that arena that then can be expanded to partnerships with some of the other law enforcement agencies. So yeah, there is overlap, but we know where those boundaries are, and we have been working as a team internally, the staff level, to try and make sure that there's not duplication or crossing of wires.
Yes, Commissioner Ojero and myself meet with Danielle Brown, our Behavioral Health Director, and Nick Kurth, who is the coordinator for the Criminal Justice Systems Improvement Plan, on a routine basis so that we can talk about all of these different efforts to reduce any of that duplicative work. The next question we have is, what is the board going to do with the survey feedback it receives from community members? Are you going to change your policy recommendations? I am going to be working at the end of this week on Thursday and Friday with city staff and county staff to read through and document all of the public feedback from the surveys, the write-in responses, and then the quantitative feedback about support and lack of support for different policy recommendations, as well as the feedback that's coming in right here in this public forum and the feedback coming in from the focus groups with clients. And the Hope Board will be meeting next week, Monday through Thursday, in their work groups on the different topic areas to make changes to their policy recommendation, to polish them, to edit them, to finalize them, to make sure that commentary and feedback that was received from the public that's constructive can help shape what these policy recommendations look like before they go to the city and the county. So yes, this public feedback will be incorporated as best as possible, given that the Hope Board also needs to be data-driven and utilize research and address the gaps in our system. So they can't just incorporate anything that everybody says, but they will be doing their best. Any other board members want to add to the response I gave? All right. We have another question that has come in. I'm concerned about crime. What do these recommendations do to address the rise in crime we're seeing across Benton County? That's a difficult question. Do any of our board members want to touch upon that?
I will provide a quick answer. As given my role with the Willamette Criminal Justice Council and the interaction I have on the law enforcement and justice side of things, we have been seeing an increase in crime, and some of it is maybe related to COVID. Some of it is possibly related to the decriminalization of possession of small amounts of street drugs under Measure 110. And it's a problem. We don't know where that will go and whether it will settle out. We haven't yet seen an upsurge in folks turning to treatment resources or substance use disorder assessments as described in Measure 110. So that new system is, as so many people said last year during the initial COVID pandemic, like trying to fly a plane while we're still building it. And clearly there's it's a problem. There are a lot of people that are unhoused that have substance use disorders, either because they did prior or because they became more susceptible afterwards because of living on the street and what horrible conditions people have to live through when they are unhoused. So it's a situation we will have to untangle thoughtfully and person by person.
Thank you, Zan. We've also had a question come in similar on this topic in the chat in the GoTo meeting. How do you as a board reach out to business or property owners in these discussions who are most affected by the current situation and homelessness occurring on or near their property, illegal camping, vandalism, trash, garbage, approaching employees or customers, with the acknowledgement that those same business and property owners pay taxes to support some of these services, the city or the county? As the staff member supporting the Hope Board, I do a lot of outreach to engage our Chamber of Commerce and our Downtown Corvallis Association that coordinates and communicates with all of the downtown business owners. In addition to that, the Hope Board has a business community representative in Christina Jansilla. Christina, did you want to touch upon this comment?
Yeah, can you hear me?
Yes, I can. Go for it.
I too empathize with the person that wants an answer to this question. As a business owner, I am inundated with vandalism, crime. I know what it's like, and that is why it is so important. The work that we do on this Hope Board is to move people from the street into something besides a tent in the woods. And it's a matter of survival. These people, the unhoused, they've got nothing, zero. And in order to survive, this is what they do. And that has got to stop. They have to have a place to go. There has to be programs. And that is the whole purpose of why I joined this board and why I am compelled to change things and make a difference, because I too am tired of the criminality that homelessness brings, the vandalism, and I completely understand, and that's why my work on this whole board is very important, because this has to stop. It has to decrease. I spend, just like everybody else in the business community, lots of money on fixing windows, graffiti, trespassing, you name it, it's there. And that's why this board is really working very hard to end this.
Thank you, Christina. Are there any other board members who want to chime in on this topic? Jan?
Yeah, I would like to reiterate that this board is why we're doing this outreach, is an example of why we want to bring everybody from the community who are stakeholders into the solution, and not have a top-down shareholder type of approach, which is just social service agencies. This is it takes a village, and if we can't just put these people away somewhere, we have to have them part of our community. They need to be invested in our community. We need to network with them. They need to feel as though they are with, part and parcel of the fabric of society, and not marginalized, and not ghettoized, and not ignored, but embraced. And it's going to take a lot of work, and it's going to take a lot of understanding, and it's going to take a lot of housing. But we have this opportunity to make a paradigm shift in our thinking about homeless people. And we've kind of, over the last, 15, 20 years, just, here's a coat and here's a tent and I'll see you later. No, we have to get everybody on board with keeping the prize in sight, which is to do our best to integrate and normalize this population.
So we have about 10 minutes left, and we have gone through all of the questions that have come in on the Facebook Live and also in the GoTo meeting. I also see community members who are here attending the GoTo meeting. Do any of you want to make a verbal comment or a question instead of typing it into the chat? Now would be your opportunity. And also, thank you to Alyssa Rash, our Public Information Officer with the county, for reminding me to ask you all to please go to the Hope Community Engagement website and complete the survey before Thursday. So you can take a survey to give feedback on all of the 12 recommendations that this board is making. Anita, I see you've been able to rejoin the meeting and you put some information in the chat. Can you go ahead and share that for our listeners who have called in or those joining us on Facebook Live?
Oh, sure. I'm so sorry for my technical difficulties. I was just wanting to respond to the question about accountability because I think that's everyone's question, you know, and the idea of accountability presumes that someone has personal power. And if you are in an environment where you are ritually shamed and you're fragile and your most primal need for safety is not met, and you're probably there because you've experienced some trauma, there is no way that you have the psychic, emotional, spiritual, psychological energy to feel empowered enough to respond to anything. You know, so I just wanted to share that I think the ethos of the Hope Board is that we have deep understanding of what that trauma and that fragility might be like. And so our programs, our dreams for how to address this need in Corvallis is deeply held in the idea that the people who are going to help us with those programs and address these resources are going to hold a trauma-informed perspective. And so not only the pragmatic, but the eye to how it is you slowly allow someone to unwind and address their brokenness and their fear, then they become empowered. It's the collateral gain of kindness and respect and human service in general.
Thank you, Anita. I'd like to let the board members know, if you haven't noticed already, that quite a few community members have chimed in with their thanks for this opportunity to have a public forum, to voice these questions and comments and have dialogue and discussion. So I want to make sure you all are hearing that and seeing that. Is there any other commentary from the community about these draft recommendations that the Hope Board will be finalizing next week based on this community feedback? All right. Well, thank you all for being here this evening. Let me just confirm that we have nothing else that has come in on Facebook Live or on GoTo.
No, we have finished all of our questions and comments. So we will once again remind the audience that our survey closes on April 15th. You can visit the Hope Community Engagement webpage to learn more about the draft recommendations and participate in that survey. It's linked several times in the chat feature here on GoToMeeting, and it is also a pinned link on the Facebook Live.
Thank you, Alyssa. Thanks everyone for being here tonight. Do we have any closing thoughts from our board members about what you learned here tonight or next steps in the coming weeks? I'm glad to have been able to help host this and facilitate it. And thanks to all of our community who attended and is giving feedback on these recommendations. The board will do their best to incorporate public feedback into their recommendations next week and finalize draft recommendations at their April meeting. That's the fourth Wednesday in April, and you can find a link to that meeting in the agenda that's posted on the Hope website. And then the city and county elected officials, so that's Corvallis City Councilors and the county commissioners, will be meeting on May 20th to start the process of reviewing and adopting the Hope recommendations that are coming to them from this board. Thank you all for being here tonight. I'm going to go ahead and end our public forum, and I look forward to seeing you all next week in your work groups. Thank you all for attending.